Hello, everybody, and thank you for joining this month's Kapnick Strive webinar. Today, we're going to be talking ergonomics, promoting good posture, and bone health. So without further ado, let's go ahead and get started. Now, starting off with understanding muscle strain. So what is a muscle strain? A muscle strain is simply an injury to a muscle or a tendon, which is the fibrous tissue that connects muscles to bones. Minor injuries may only overstretch a muscle or a tendon, while more severe injuries may involve partial or complete tears in these tissues. Sometimes called pulled muscles, strains commonly occur in the lower back and in the muscles at the back of the thigh, the hamstrings. Now, the difference between a strain and a sprain is that a strain involves an injury to the muscle or the band of tissue that attaches the muscle to the bone, while a sprain injures the bands of tissue that connect two bones together. Both are painful. As many of us know and have likely experienced, initial treatment includes rest, ice, compression, and elevation. Now, mild strains can be successfully treated at home, but some severe strains sometimes require surgical repair. All in all, muscle strains can be an all-encompassing burden, hindering daily activities and stopping us from reaching our full potential. Treating muscle pain promptly can prevent it from evolving into a chronic condition and, in turn, can lead to a more active and enjoyable life, which is something we'll be talking more on later in this presentation. So let's go over some statistics. Musculoskeletal pain is incredibly common and affects more than 1 out of every 2 people in the United States aged 18 and older, and it affects nearly 3 out of 4 people aged 65 and older. Approximately 1.71 billion people have musculoskeletal conditions worldwide. They're additionally the leading contributor to disability worldwide, with low back pain being the single leading cause of disability in 160 countries. So this is something that affects pretty much all of us, at least at one point in our life or another, which is why prevention and treating our bodies kindly is so important. So a special note on back pain. So even if you have never had back pain, you've definitely heard someone else talk about their back pain. Just in back pain alone, nearly 65 million Americans report a recent episode. 8% of all adults, which is equal to 16 million people, experience persistent or chronic back pain, and as a result are limited in certain everyday activities. It's the sixth most costly condition in the United States, and healthcare costs and indirect costs due to back pain are over $12 billion per year. In addition to this, some 83 million days of work are lost per year just due to back pain, and it's the leading cause of work lost days and work limitations. You may be thinking, okay, I get that back pain is so common, but why? There's a few reasons: overuse, poor posture, carrying heavy loads with improper form. But think about how central your spine is to your body. It's involved in every movement we make, whether we realize it or not. This is why it's so important to take care of our bones, which is leading us right into bone health. How can we improve bone health and help prevent musculoskeletal pain? First, we want to be eating foods that are supporting our bones. So we want to be getting enough calcium, vitamin D, and protein each day. This looks like eating low-fat dairy, leafy green vegetables, fish, and fortified juices, milk, and grains, which are all good sources of calcium. If your vitamin D level is low, talk with your doctor. Secondly, we want to be getting active. So choose weight-bearing exercise like strength training, walking, hiking, jogging, climbing the stairs, dancing. This type of physical activity can help build and strengthen your bones. Thirdly, don't smoke. Don't start if you already don't smoke. Smoking increases the risk of weakened bones. And lastly, we want to limit alcohol consumption, as too much can also harm our bones. So this looks like drinking in moderation, which is no more than 2 standard drinks for males in a day and no more than 1 for females in a day, or not at all. These behaviors, in addition to improving ergonomics, can help protect our musculoskeletal health and reduce or prevent pain. Now, it's in the title of this webinar, ergonomics. So what is ergonomics? It's all about creating things that work well with our bodies and how we move. It's about designing products, tools, and environments in a way that makes them comfortable, efficient, and safe to use. So some examples of ergonomic products you've likely seen include things like office chairs, keyboards, scissors, and even kitchen and gardening tools. Ergonomic design helps us avoid unnecessary muscle strain or injuries and allows us to perform tasks better, whether it's using a computer, sitting at a desk, or doing everyday activities. When we are at risk of injury and when could we benefit from ergonomic design and proper form or posture? So during times of high repetition, so when we're engaging in repetitive tasks without proper breaks or variation, it can lead to overuse injuries like carpal tunnel syndrome or tendonitis. Again, when there's forceful exertion. So when we're using incorrect lifting techniques or when we're lifting objects that are too heavy for one person, this can strain the back and lead to those musculoskeletal injuries. And then lastly, being in awkward positions is an ergonomic risk factor. So when we are sitting, standing, or working in positions that strain the muscles and misalign the spine, such as slouching or hunching over a desk. Next, we are going to be talking some ergonomic tips that can help us improve our bone health and prevent muscle strain and injury. First off, and you likely knew this was coming, but maintaining good posture. This is one of the most influential factors that contributes to back pain and muscle pain. So we'll start off with two because we sit and stand a lot. So when we're sitting, we want to be sitting in the back of our chair and position our thighs horizontal to your knees at hip level, making a 90-degree angle. So there should be a 90-degree angle between the tops of your thighs and your upper body, your torso. You want to make sure that your feet are flat on the floor. Now, for many of us, this is likely easier said than done, but do not cross your legs. Crossing your legs actually puts an extreme amount of pressure on your lower back. Now, when standing, we want to pretend that we're standing against a wall to measure our height. So hold your head straight, tuck in your chin, stand with your shoulders back. It can help to kind of roll them upwards and back. Have your knees straight and belly tucked in. So a visualization that an old coach I have used to tell me is to imagine a string running through your body from your feet all the way to the very top of your head. Now, if you were to pull that string taut from the top of your head, your posture should be pulled upright and be aligned, kind of like a puppet. If the string is limp or loose, then you are likely slouching or out of alignment. I'm going to pass this over to Lexi, who's going to talk a little bit more about posture.
Thanks, Emma. As you were giving those tips, I was definitely improving my posture. But moreover, it's important to be mindful of your posture, especially during everyday activities, watching television, washing the dishes, walking, and being conscious of your stance and adjusting as needed. First one, again, tying in with Emma said, don't hunch over your desk. Sit all the way back in your chair. And if you can't reach the back of your chair, or if you feel like that might be too far back, place a small rolled up towel or a lumbar cushion behind your mid-back for support. You can bend your knees at a right angle and keep them the same height or a little bit higher than your hips with your feet flat on the floor. Next is text neck. Yes, this is a thing. When you tilt your head towards to check messages or scroll through your phone, it really puts strain on your spine. So take a minute to stretch your neck. And I want to take a minute to note that in terms of health, there is no such thing as perfect posture or one exact body position everyone should be in. Rather, everyone is unique and has their own individual posture. There are still some general guidelines for finding a comfortable and supportive posture. This could be like keeping your screen at eye level, not leaning forward, and keeping your feet flat on the ground while sitting. We'll talk about that in a sec. Next is taking additional breaks. So during prolonged periods of sitting or standing, taking short breaks every 30 to 60 minutes to stretch, walk around, get some water, get a snack, or to check up in on a coworker, and change your position to reduce stress on your spine and joints. Now, obviously, there are some instances where we may not be able to do this, like if you're in the window seat on a long flight, and that's okay. Again, we don't need perfect posture all the time. Rather, we should be moving our bodies when we can and finding positions that are comfortable for us within the general ergonomic guidelines. Another thing we should take care of for our bodies, especially if we want to avoid reducing back pain, is to lift properly, using those proper lifting techniques. Now, when lifting heavy objects, bend your knees and use your leg muscles, not your back when you're lifting. I always keep this on the forefront when I'm lifting something. I always say, use your legs, not your back. Use your legs, not your back. So holding the object close to your body and avoid twisting while lifting. Next, another tip is adjusting your screen. Making sure your screen is at eye level and at least an arm's length away. If your screen position causes you to look up or down, it can lead to neck pain and back pain. And if you have more than one monitor, make sure you put them close together and angle them so that you're not moving your neck as much. Lastly, use ergonomic solutions as much as possible. Invest in an ergonomic chair that provides good lumbar support. And other features to look for in that supportive chair are that head and neck support, adjustable back, adjustable height, a back spine that supports that natural curve of the spine, armrests, a little swivel, and padded material. So to reiterate how to sit properly, ensuring the least amount of back and muscle strain, sit back in the back of your chair and position your thighs horizontal to your knees at hip level. And resting your feet comfortably on the floor or on a foot rest in front of you. So get a sit and stand desk. Having a sit-stand desk is a great way to increasing energy and prevent back pain. Your body burns more calories standing than it does sitting, so it can even help with that weight loss. And if you do not want to invest in a new desk, you can purchase a standing desk or a laptop stand converter to go on the top of your desk. I know Amazon has a ton of options. And last on the list, reposition your work table to eliminate a long, excessive reach and enable working in neutral positions. Now let's explore some additional strategies to effectively reduce muscle strain and enhance our well-being. The first tip is stretching daily. So regular stretching can do wonders in reducing muscle strain. It not only promotes bone health, but can also help alleviate the muscle tension. It significantly decreases the risk of strain in your daily activities. If you find it hard to get into a habit of stretching, it may be helpful to schedule it into your day or even habit stack. I don't particularly enjoy stretching, but when I do, I feel so much better when I'm watching like TV or somebody videos on my phone, which helps my brain incentivize the activity. 2 is lighten the load. Managing the weight you carry is another critical factor in minimizing muscle strain. The key here is to keep the weight you carry under 10% of your body. of your body weight, excuse me. As much as we hate making multiple trips between the car and the house to carry in groceries, I'm guilty of this. This practice is essential to preventing excessive strain on your muscles, especially your back. And then next is reducing pressure while sleeping. So consider if you are a back sleeper, elevate your knees slightly with a pillow while sleeping, and then using a pillow between your knees if you like to sleep on your side. These are effective strategies that can reduce pressure on your muscles and minimize strain. Now let's explore some ways to improve posture. One is exercise regularly. So, did you know that even just 30 minutes of low-packed exercise a day can work wonders for your posture? Regular physical activity strengthens the support muscles in your back and abs, which naturally aid in your posture correction. So by incorporating exercise into your daily routine, you're taking those proactive steps towards maintaining a healthy and upright posture. As Emma mentioned a little bit earlier, is maintaining adequate nutrition, specifically calcium and vitamin D intake. So these nutrients play a pivotal role in maintaining bone strength, which in turn supports good posture. So by doing so, you can reduce the risk of developing conditions like osteoporosis, further enhancing your overall posture. And then the third tip to improving your overall posture, which is often overlooked aspect, is being mindful of stress and the body behavior awareness. Stress tends to activate the muscles of the neck, upper back, and jaw, which leads to those postural issues. So additionally, prolonged periods of sitting can promote poor posture and strain in the back, which can cause discomfort such as headaches, neck pain, and low back aching. So by becoming more aware of your stress levels and posture, you can intervene sooner and make long-term improvements. And really, by integrating any of these tips that we have given you, whether it's one or all, your awareness of stress and body behavior, balanced diet, regular eating, stretching, having a standing desk, an ergonomic chair, you can take significant steps towards a healthier, more upright posture. And remember, good posture isn't just about appearances or simply sitting up straight. It's about supporting your body's structural integrity and minimizing the risk of discomfort and health issues in the long run. And if you are interested in learning more about this topic, here we have 3 different resources for you. The first is Office Ergonomics. This is how you can implement this in a short video that's provided on YouTube. They have simple solutions, so you can, again, watch the recording of this video, or you can watch a video that they have as well to learn more. If you're not into YouTube videos and you like more podcasts, there's a podcast called Safety Podcast. It connects workplace ergonomics to your health and well-being. And if you're looking more for a simple stretch workout that you can do right at your desk, there is a simple YouTube video that you can watch. It's within 5 minutes, so very quick. We all have 5 minutes that we can spare on ways that you can improve your muscle pain and posture. So on that note, thank you everybody for attending today's presentation. We will see you next month in October. I can't believe it's already here for Community Care and Social Wellbeing on October 25th between noon and noon 30 Eastern Standard Time. There's a QR code right there. Scan ahead and you can register today. So thank you everybody. Have a great day.